Hi everyone. Have you ever noticed or met anyone who suddenly has chest pain or sweating or feels like they're going to die or like a choking sensation and they really can't breathe? The answer to that would be yes. Majority of you would have met someone who's had this problem, or it might be you. Good morning everyone. My name is Dr. Garima Yadav and I'm a second year Child and Adolescent Psychiatry Fellow at Texas Tech University, Permian Basin. And today I'm going to be talking to you about our most common problem that all of us have faced sometime in our life called panic attack. So what is a panic attack? A panic attack is an episode of intense fear with an abrupt onset that can last from several minutes to up to an hour. It has many mental and physical problems and symptoms such as chest pain, shortness of breath, dizziness, and a very bad feeling of unease and impending doom. These symptoms may cause significant worry in people as they mimic signs of medical problems such as heart issues. Many of you might have felt that I'm having a heart attack when it's just a panic attack. However, panic attacks can occur because of no apparent reason or cause. They just happen. And a panic attack can cause a feeling and sudden immense fear and strong physical reactions in response to ordinary, non-threatening situations. And this can be very frightening for the person undergoing one and their loved ones. So now you might be thinking, how can we distinguish between a panic attack or an anxiety attack? So let me tell you that. So the main difference is that an anxiety attack is very mild and it takes time for it to build up over time. And it can go on for quite some time. And you might be getting a very specific trigger for it and you would be thinking about it, and that's how you keep becoming anxious and have an anxiety attack. But on the other hand, a panic attack can occur because of no reason. There is no cause for it. And these symptoms will come all of a sudden and they'll be for a brief, short period of time, leaving you completely terrified. So how common are panic attacks? So if you see, panic attacks are very common. Every year, up to 11% of people in the United States suffer from a panic attack, and approximately 2% to 3% of them are diagnosed with a panic disorder. So you might be thinking, what is the difference between panic attack and a panic disorder? So just let me say it in very simple words. So it's like when you have multiple panic attacks over a period of time, you're diagnosed with a panic disorder. So how do you recognize the symptoms of panic attacks? A panic attack often occurs suddenly and it'll start for 1 minute and suddenly the symptoms will rise up to 10 minutes. It can be short and can last up to 1 hour. Okay, and suddenly the symptoms are going to disappear. So what are the physical symptoms that you're going to see with a panic attack? So symptoms are going to be like chest pain, racing heart, difficulty breathing, trembling. You'll have these tingling or numbness sensations in your hands and feet. You'll have chills, nausea. You'll start getting very sweaty, and you'll have this intense fear, a choking or smothering sensation, fear of losing control. And you have this feel like either you're having a heart attack or you're going to die. Some people also have feelings of derealization and depersonalization. And I know those look like big terms, but it's simply you feel like you're very detached from yourself and you feel like everything around you is unreal, in simple terms. So if any of you has suffered from a panic attack or seen these symptoms in yourself or your loved ones, you need to go see your healthcare provider because you need to be diagnosed with it. It is a treatable disease. Okay, and it is not something we need to be afraid of. It is something we can actually work on together and help people with it. So for an example, I would say, like I've been saying for quite some time, it can occur without any reason. But sometimes it can also occur in people who have phobias. If you're scared of something and suddenly you're exposed to that thing, you're gonna get a panic attack. So let's say the most simple fears, like kids or adults who are scared of needles. So if you're scared of needles and you have to go and get your blood drawn, all of a sudden you're going to have a panic attack because you're so scared, and that anxiety and that scared feeling makes you have a panic attack and you feel like you can't breathe. and your heart's racing and you don't understand what's happening with you. So, how are panic attacks diagnosed? Is there a test for a panic attack? So, apparently, there are no tests for panic attacks. But of course, with the symptoms and the signs, your healthcare provider can rule out other medical diagnoses and come to a conclusion of panic attack. So how do you treat a panic attack? The treatment goes in two ways, either with the help of medications like antidepressants or therapy. Therapy and medications together provide a very good treatment for panic attacks. So you should go for cognitive behavioral therapy, talk to your therapist, come to your healthcare provider, get to know how it happens and get a hold of whatever is troubling you in life. And I would say, please go see your healthcare provider. Thank you so much and have a good day and have a blessed day. Thank you.